Hi everyone, this is Lindsey Pulcer, and I'm going to present on hepatitis C or HCV, hepatitis C virus. So a little bit of background information about hep C. We all know hepatitis means inflammation of the liver. The causative agent with hep C is the hep C virus. It's an RNA virus that's enveloped, and there are at least 6 different genotypes of the virus, which of course makes this a bit more difficult to treat. There currently is no available vaccine, although researchers are working on making one. Hep C infection can either be acute or chronic, and the acute form, it's a short-term mild illness that the body can clear without any kind of intervention. This is less likely than the other, which is the chronic long-term illness. This may lead to long-term liver damage, cirrhosis, or liver cancer, and 75 to 85% of cases do become chronic. Signs and symptoms of hep C infection: 60 to 70% of newly infected hep C cases are asymptomatic or have extremely mild flu-like symptoms. These symptoms can include fever, nausea, loss of appetite, muscle and joint pains, tenderness around the liver, abdominal pain, vomiting, and of course we all know the telltale sign of jaundice with the yellowing of the skin and sclera of the eyes, and clay-colored stool. Communicability: most people, once they're infected, they can transmit the virus from the time of infection onward, unless the infection is cleared somehow, but even then the virus still remains in the bloodstream and can be transmitted. And of course, once people are treated with antivirals and such, if a person's viral load decreases, it's less likely that they will spread the virus, but they still can transmit it. Hep C can survive outside the body on environmental surfaces for anywhere from 16 hours to 4 days. So it's a pretty hardy virus. I wanted to look into hep C because it is one of the leading causes for liver transplants in the United States, and it is the most common chronic bloodborne infection in the United States. Especially with us all being nurses and future nurse educators, administrators, nurse practitioners, hep C is something that we are exposed to on a daily basis with starting IVs and with being exposed to patients' blood, so it's something that is very pertinent for healthcare workers. Transmission of hep C. Hep C is transmitted primarily through exposure of one's blood to infected blood, either through injection drug use. This, unfortunately, is the most common way that people contract the virus. They've been sharing needles from injecting illicit drugs. Also, receiving donated blood, blood products, and organs. This is rare in the U.S. now with our safe testing of donated blood products, but prior to 1992, this was a very common way to contract hep C. Also, getting piercings and tattoos from needles that haven't they're not sterile equipment that's being used. Also, we all know about needle stick injuries in healthcare settings. That's something that's pertinent to all of us. Also, this can be transmitted in the vertical sense from a hep C positive mother having a baby. It can be transmitted to the baby. A less likely but still viable way to transmit hep C is through sexual contact with a hep C positive person. And finally, sharing personal items contaminated with even a small amount of infected blood, such as toothbrushes or especially razors. So no sharing of personal products. The groups that are mostly at risk for contracting hep C are any IV drug users, people who have received blood transfusions, clotting factors, or organ transplants before 1992, like we talked about when they started routinely screening for hep C in blood products. Also, healthcare workers after needle sticks, HIV positive individuals because of their low immunity to pathogens, babies born to Hep C positive mothers, and long-term hemodialysis patients. I found this to be a little bit scary. Approximately 2 to 3% of the entire world population is infected with Hep C. Furthermore, 3.5 million people in the U.S. are Hep C positive. That's quite a large number. The CDC states that there were 2,138 new cases reported in the U.S. in 2013, but the CDC estimates that the real number is probably closer to about 30,000 in the U.S. in 2013 due to underreporting and people not even knowing that they have Hep C. And I thought this was an interesting graphic representation of the incidence over the years in the U.S. You can see how it spiked around 1990 in the late 80s, and it has come down quite a bit from then, probably with the identification of the disease and with ways to prevent it, more education, that sort of thing, and also with the screening of blood products and organs transplants and such has helped to reduce the incidence of the disease. So some people don't take Hep C as seriously as they should because, as we talked about, a lot of people are asymptomatic. Even though they're Hep C positive, they don't have many issues with it. But long-term Hep C infection, if not treated, can lead to cirrhosis. And there's a nice picture of a healthy liver and a seriously scarred cirrhotic liver. And also liver cancer and eventually liver failure that can lead to death. So the most common way to treat chronic Hep C infection is by combination of using two different drugs, which is interferon, which is injected. It interferes essentially with the replication of the virus, and I believe ribavirin is an oral antiviral. Also, there are a couple new drugs that have been approved recently by the FDA, and I've got them listed there. In extreme cases where the virus has completely taxed the liver and a person has gone into liver failure, liver transplants are a viable option as well. And of course, I have to mention that many people don't seek treatment because they're asymptomatic or the cost of antiviral therapy is extremely high. Finally, side effects of antivirals often lead patients to stopping treatment because they just can't tolerate how they're feeling when they're on the meds, with feeling nauseous and sick, and sicker than they felt essentially with just having the virus. So they just choose to not seek treatment or discontinue treatment. So an ounce of prevention is worth a pound of cure, right? So how do we prevent Hep C infection? Well, one of the biggest things is to educate about Hep C infection, especially with our high-risk populations, especially with our IV drug users. It's important to encourage screening if a person's in a high-risk group, such as the IV drug users. We must be really, really careful with sharps when we're working with giving injections, starting IVs, all that kind of thing. Also, this is a bit of a controversial preventative measure, but there are some places that offer something called needle exchange programs, which basically allows IV drug users to turn in their dirty needles in exchange for clean needles. It's kind of just a way to prevent them from sharing needles so they're not sharing, HIV and Hep C as well. Some people don't support that because they feel that it's encouraging the drug use, but it is essentially helping to not spread disease. Also, it's important to stress the importance of caution with body piercing and tattooing, making sure that you're going to a a certified and well-reviewed tattoo parlor, piercing parlor, and so forth. Also encouraging safer sex practices, using condoms. People that are already infected with Hep C must not use alcohol or any kind of drugs that could be hard on their liver, educating them that they can't be taking Tylenol anymore, and anything that would tax the liver further, we want to prevent that to try to give the liver time to rest. Finally, in those that are already infected with Hep C, we need to focus on reducing the viral load, which we can do that by using antivirals that we talked about. And here are a list of references. Thanks everyone for listening.